Attention, all medical staff. Trauma code for children.
For the first time, we gain unprecedented access into Singapore's largest children's intensive care unit.
Working in the ICU, even if your feet are paddling furiously underwater, you have to still be able to perform efficiently.
Sense are improving.
This week,
some of these complications can be fatal.
parents and doctors confront impossible dilemmas.
You have to weigh this benefit versus the risk.
It's a chicken and egg thing, right? Damn if you do and damn if you don't.
We can't really wait until she's totally well before we can actually do the extubating.
Marcus, mommy is here. Marcus. Okay, mommy is here, okay? Don't worry.
9-year-old Marcus has been admitted into the children's ICU. One minute he was on a soccer field, and the next he was in an ambulance with intense chest pains.
Can we then just keep the same response to the 5, then 5 to 8?
Marcus's heart rhythm is completely out of whack. He needs to be watched round the clock, or he could collapse any time.
Too much air moving.
Collapse means his heart basically stops beating. There's not enough blood flow to support any of his vital organs. It's almost like what we call a cardiac arrest. He is dead at the time of cardiac arrest.
Only at the children's ICU can Marcus receive the critical care that he needs.
So Marcus's main condition is myocarditis, which is an inflammation of the heart muscle. This is probably a viral infection, and the virus has got into the heart and causing damage and injury to the heart muscle. It's contracting but not completely normal. Okay. When there's flow pushing, myocarditis carries risk of death of approximately 25 to 30%.
I was shocked because I didn't realize that it's so critical. From just a usual chest pain, and then in 2 days period you tell me that okay, it's a viral infection. How can a viral infection be so detrimental and it attacks the heart and basically he just collapsed? Cold? Okay. Do you have a thicker blanket? It's a bit cold.
The bigger blanket, is it?
The thicker one. I just keep asking, you know, how did it happen? Where did it happen? Nobody can answer that question. Even the doctors can't answer that question. And we really don't know how. Anything is squeeze for me, please, okay? Okay?
Okay, mommy, have you checked? Mommy, have you checked? Mommy, they need to check. We ask Nene to come. Nene, put the stethoscope.
3-year-old Alia has childhood leukemia.
Okay, Nene, put, okay, come.
4 rounds of chemotherapy have left Alia neutropenic, a condition where her white blood count is low.
Okay, then mommy hold Alia's hand, Nene, listen.
Over the past week, the CICU doctors managed to keep a bloodstream infection at bay.
Okay, no more. Okay, finish. Want to change? Change diaper, okay? Definitely the past few days it has been going up. Okay. So that's good for her as well. It will help her to fight the infection. Okay. Blood culture also is 24 hours negative. She was getting antibiotics for a long period.
But now, a cut in her anus is threatening to blow up into another deadly infection.
Yeah, so she always cry for you. Hello. Okay, Uncle just here.
Yeah, we change diaper.
This part is becoming a chronic scar. Yeah. This part I don't see anything. Okay, done.
Okay.
It's a blood stain actually.
A lot of blood or just a little bit?
Sorry, just like the blood, is it a little bit or Little bit.
I don't see any blood right now, so
Yeah,
I don't think we're
they just
dealing with
feel-
a massive bleeding.
Okay.
Maybe part of infection. We keep an eye on that. Let me go and speak to Dr. Low first.
Okay.
The doctors must decide whether to escalate intervention by creating a stoma bag, which collects stools from her intestines instead of her anus, to keep the perianal wound clean.
The decision for Olia's stoma creation was actually a very, very challenging decision to make. Her neutrophil was very low, her immunity is very weak, and also her ability to clot her blood is also very, very, very bad. So putting these factors together, the risk of performing an operation such as stoma creation actually pose very high risk.
One day after being admitted into the ICU, Marcus's blood pressure plummets. This and his erratic heartbeat are warning signs that Marcus is in danger of multiple organ failure.
His heart function was deteriorating in front of our eyes to a point where the heart was hardly moving at all. 5 different machines are alarming, 2 nurses are calling you, 1 doctor is saying something, your patient is clinically deteriorating in front of you, and having to process all those inputs and information and formulating a plan of action. It is challenging to remain calm when all hell breaks loose. Do you want to take out the ECMO? Where's my cardiac bag?
The doctors must make a quick decision whether to hook Marcus up to a heart-lung bypass machine that could save his life. But it is an extremely high-risk procedure.
Because we're drawing all your blood out and we're running it through an external device with external tubings, anytime blood comes out of your body, it wants to clot. And the problem when we return blood back is if there's risk of clotting, the clots may also travel into the bloodstream, and one of the worst complications of that will get a stroke or you get a heart attack essentially.
9-year-old Marcus is at risk of a cardiac arrest, and the doctors make the call to hook him on a heart-lung bypass machine called ECMO, or extracorporeal membrane oxygenation.
The moment the doctors called me, he has to be moved to be supported by ECMO, was already telling me, oh my God, there is a high chance that I will lose him.
Just moments after the doctors completed the procedure,
Prof Tan actually told me that his heart stopped beating. So that was really scary for a mom to hear that. At that time, he's totally sedated and paralyzed. So there's nothing much I can do except to really just pray that he will come back.
Marcus is now relying solely on a machine to pump blood around his body.
We were very thankful that we put in the ECMO as early as we did, because if we had waited any longer, Marcus's life would have been in danger.
Luckily, the machine is keeping Marcus alive. But nobody can tell when or even whether Marcus's heart function would return.
It's a nightmare. I mean, it's just a bad nightmare that I hope no parents have to go through.
Aulia has been on intravenous nutrition for the last 2 weeks to avoid exacerbation of a perianal infection. It's been a while since she's eaten anything orally, but her wound still hasn't healed.
Doctors has managed to overcome the infection with antibiotic. But it looks like the battle only ended, there's still a war going on. Her fever, although coming down, is still hanging down there. We don't really know when is the end of all these infections. I think to make the question easier for you is, should we do stoma opening in exchange of earlier feeding and also easier wound care? I think those two benefits.
If Aulia's parents still don't agree to the surgery, Aulia may have to be on intravenous nutrition for up to a month, which could lead to liver damage and further infections.
That's the thing. You have to weigh this benefit versus the risk, which is 20 to 30% chance, and stoma may have some complications. Talk to your husband, talk to your family, and then you make a decision and let us know. It's all like a chain reaction. It's a cascade event. You can't say whether this is due to that, but everything contributes. But that's what happened to oncology patients. All the factors will come together, and you just have to make the best decision you can, considering all the factors.
With the discussion just now, I have to make a very fast decision by tomorrow whether we are opening the stoma for Aulia. But she's in ICU for a while. Right. She's going to get better soon.
Don't worry. We pray for that.
Yes.
Trust. Okay. Trust.
Okay, see you.
Today, Dr. Chen is checking on Marcus. He detects a weak pulse.
Yeah, but you can actually feel the pulse. That's weak.
That's good news. After 48 hours of not beating, Marcus's heart is slowly regaining strength.
Is it normal for the heart, for the rate not to have any pulse or very weak pulse? Because they couldn't get the reading.
Can feel. Okay. The pulse is not going to be strong though. If you feel his own pulse, so long as the skin is warm, nice and warm, I think that's fine.
Yeah, actually mine is colder than his.
Yeah.
Are you having pain? You just feel uncomfortable, is it? Okay. Then you can move a little bit, but not too much. Okay. The important things are in your neck and in your mouth. Okay. These are the important ones. The one on your hand and all that, if you want to move, is okay.
Today is day 7 of ECMO, VA ECMO, which is most significantly complicated by rhythm problems. He has underlying heart block.
It's okay. Later we do sitting up, okay?
His other problem is that of likely hospital-acquired pneumonia, for which we have not been able to isolate any microorganism in terms of the etiology of what bug is causing it.
Finish.
Every time I receive a piece of good news, I will hear other complications and other risks that are involved. So that's the difficult part for me, because it's like walking one step ahead and then, back 3 steps, because there are other risks that are involved and other complications.
Despite the antibiotics, Marcus's lungs are still infected by a bacteria, which has led to a full-blown pneumonia. Doctors now have little choice but to put Marcus through an invasive procedure again.
We had to do what we call a bronchoscopy for him, which is essentially a small fiber optic scope that we pass through his breathing tube.
Any pathology? No.
Basically to look for any secretions that we can help to clear to help open up his lungs better.
But what was supposed to be a straightforward procedure has uncovered complications yet again. The doctors are doing a bronchoscopy to treat Marcus's pneumonia. They managed to clear the mucus plugs caused by the infection. But during the procedure, the doctors also found blood clots in his lungs.
So sometimes some of these complications can be fatal. For example, blood clot formation within the ECMO circuit.
Give you a bit of water. Open your mouth.
Marcus has been relying on a heart-lung bypass machine called ECMO to pump blood through his body.
The longer we keep patients on ECMO, the higher the complications associated with it.
When there is a clog, and if the clog moves to the pump, it basically auto shut down the system. So you can imagine if it auto shuts down, when Marcus is relying heavily, in fact 100% on the machine, that's going to just basically end his life.
Is it painful or dry? If it's dry, you hold it. Painful? Dry. It's dry. Okay, so it's not painful, right? Okay, good. So it's just the throat, is it? Okay? And do you want
Marcus, check tummy, okay? Any problem with the pump?
The doctors need to make a decision. When should they remove the ECMO machine, which is keeping Marcus alive now?
Judith, from the ventilator point of view, your right lower lobe is developing another patch. Can we do better with our ventilation?
I don't think it's related to the ventilation.
While the doctors deliberate on the next course of action, Sin Lin's parents have to decide on their daughter's fate.
Hello. Let's listen, okay?
Ding Shan and his wife want their daughter to go home soon.
Can I feel your tummy? Okay.
To do that, they need to remove her from a ventilator, which delivers oxygen to her lungs. But nobody knows if Sin Lin can survive the process known as extubation.
What time do you
After your round.
Okay. After physio.
If she still decide on Sunday, then will we still proceed on Monday? We'll confirm on Monday again.
If we delay it, sometimes also on prolonged ventilation, the muscles itself also may be deconditioned. Okay?
Okay? Okay? Okay, bye-bye. Bye-bye.
Mucus secretion in Sin Lin's lungs are blocking her air passage. But the 3-year-old is too weak to cough out the phlegm. She's born with spinal muscular atrophy, or SMA, a genetic disease that weakens her muscles progressively. And the longer she is on the ventilator, the faster her muscles decondition.
The chances of her being able to extubate her successfully is about, to miss 50%. So to me and my wife, it's painful to actually see her suffer.
Mama, okay? Then Papa, Mama, okay?
Ding Shan and his wife now confronts the dilemma. If Sin Lin struggles to breathe when they remove the ventilator, should they resuscitate her and hook her on the machine yet again? Or do they let her go?
The problem was when we tried to come off our breathing support, she failed that first time, and with the discussion with the parents, we put her back on breathing support.
She had a first trial of extubation 2 Fridays back, for which she had multiple desaturations, and after discussion with parents, we reintubated her after about 1.5 days. That was on last Sunday.
The difficult decision for the parents is really, do we use the full might of medical technology to support her, but knowing that it is still, at this present moment, with what scientific advancement we have no cure for her underlying condition.
Dr. Mo was saying that this time around she looks more tired as compared to the previous time when we do the extubation. Then she was saying that by looking at the machine's reading, she seems to require more energy to actually breathe on her own.
Do I continue to subject her to my invasive support, being in a hospital, being in the ICU, having lines and tubes and things poked into her? Or do I say enough is enough and we should allow her to go naturally? I think the parent's dilemma is really that she always looks so much better and obviously responds so well once we get the tube in.
It would be better if next week then we do extubation. Give her some time to rest.
Then maybe meantime we can call Papa Mama first to see whether maybe to let them know that this time around is a bit different from the previous hospitalization already.
This afternoon, they are making molds of Sin Lin's hands and feet. It would be a final memento for if the inevitable happens.
In case Sin Lin can't sustain or this extubation is actually not successful, then it may be time that we have to decide to actually maybe to let her go.
Okay, so we'll wait for
4 hours.
4 hours, about 4 hours. Hope it's successful.
In preparation for the extubation, the doctors move Sin Lin to an isolation room to give her family privacy.
Maybe it's very hot. Kiss maybe. So next time you don't have your baby beside you already, okay? Understand? So maybe I love you. You're always in my heart. You're always in my heart.